Well, we thank Dr. Bonner so much for her remarks, very inspiring, and we certainly will heed her words of keeping those things in mind as we go forward in the event. I'd now like to bring in my colleague, Amanda Winters, to discuss this resource and how governors can approach these direct care workforce challenges identified by Dr. Bonner. Amanda?
Great. Thank you so much, Shelby. And we won't have any technical issues with mine because I am live here, not recorded. So apologies for that, but I think we're all used to it over the past year and a half of being entirely in little boxes on screens. So my name is Amanda Winters, and I am Program Director for Post-Secondary Education at the National Governors Association Center for Best Practices. In the way that I build out our post-secondary portfolio, I found the power of post-secondary is in its connection to other critical areas of policy. And there is none more critical now than the health sector, particularly the equity and retention issues related to the direct care workforce. Almost every state and territory lists health as one of their top 3 high-need sectors for education and workforce pathways. This has only been exacerbated during a global pandemic. And while the need for these health professionals is great, state education and workforce systems also have to grapple with the fact that many of these direct care roles do not offer a living wage. At the same time, these roles are largely filled by women of color. And a recent report by PHI found that there's 4.6 million workers within this sector. 85 to 90% are female. Up to 62% are people of color. Up to 54% have a high school or less education. Many of them access public assistance. A third of them lack affordable housing. And many of them are parents or primary caregivers for children under 18. So in response to efforts in states to balance the needs of healthcare systems and economic mobility of the direct care workforce, the National Governors Association Center for Best Practices undertook a collaborative project to hear from states and stakeholders about strategies to meet these dual priorities and the challenges that are facing them. This effort turned into an issue brief, which we are very excited to preview with all of you today. This issue brief provides a series of multi-sector state and employer strategies to address recruitment and health sector retention of direct care workers while balancing workforce needs, job quality, and wages. It's a really interesting marriage of health policy, which I learned a lot about during this work, and career pathway development, which I'm deeply involved in on the post-secondary and workforce side. So the issue brief largely focuses on jobs that pay less than or close to 200% of the federal poverty guideline for a household of 3 in 2021. That's right at about $43,920. The strategies have even greater relevance in the wake of COVID-19 pandemic, but they are intended as longer-term opportunities. This isn't just about COVID response. This is about thinking about this sector holistically and long-term strategies to support this sector. Many of the considerations are drawn from strategies traditionally leveraged in broad sector-based workforce development planning, such as engaging workforce development boards and creating apprenticeship pathways. Some of the key considerations that you will find as you review the brief: creating a platform for cross-sector collaboration working across state agencies. Governor's offices are positioned perfectly to provide a platform for that cross-sector collaboration. Also, some strategies such as comparing, standardizing, and streamlining roles and regulatory requirements. I know it doesn't sound super exciting, regulatory requirements, but as you'll see in the issue brief, there's a lot of impact that can be made, a lot of planning that can be aligned, a lot of investment that can be aligned when the definitions and roles are clearly connected and standardized across systems. Also, consider comparing direct care roles and streamlining requirements to increase professional progression and mobility for direct care workers. Mentioned they don't have a living wage for many of these entry-level direct care positions, but they can be on a pathway to those jobs that provide family-sustaining wage for folks within this sector. And also thinking about intentional recruitment and retention strategies. Also tackling wage issues, which is foundational. There are some strategies built in to this brief around Medicaid fee structure and the potential to use Medicaid dollars for wage pass-through, and some state examples about that work. This brief does not provide all of the answers, but it begins to lay out considerations for states that speak across health and workforce policy spaces. There are systemic inequities and an economic undervaluing of this workforce that needs to be woven throughout the planning for next steps for any state to attract, support, and retain a direct care workforce. We hope that this is one piece of a larger conversation and continued technical assistance offerings for states from the National Governors Association. So there's the framing of the brief. So now we're turning, and part of our agenda, to hear from experts working on the direct care workforce challenge in the field. We're going to have some recorded remarks first, so fingers crossed, and then we're going to have some question and answer time. First, we will hear from Linda Wolford, the Interagency Coordinator for the State of Minnesota's Department of Human Services. She works primarily on Minnesota's direct care workforce shortage issues and other Olmstead initiatives related to individuals with disabilities. Then we'll hear from Dr. Marty Leathers, who was not unable to join us in person today, but we were delighted to be able to capture his perspectives in some pre-recorded remarks. He is the director of the Missouri Division of Workforce Development. He came into that role in 2017. Prior to becoming the director of Workforce Development, he most recently served as the executive director of the Center for Workforce Development at East Central College in Union, Missouri. And then finally, we will have Dr. Lindsay Schwartz, Associate Vice President of Workforce and Quality Improvement at the American Healthcare Association and the National Center for Assisted Living. Dr. Schwartz develops and implements quality improvement initiatives, including quality measurement development and data collection. She also oversees workforce initiatives for the organization. So we'll start with remarks from each of these speakers, and then we'll have the opportunity to engage directly with Lindsay and Linda in some Q&A. So feel free at any time during this recorded remarks to enter questions into the chat or the Q&A that we can bring to these speakers, and we can pull them out in the QA portion of the panel. So let's go ahead and move on and hear from Linda.